Your doctor hands you a prescription. You fill it at the pharmacy. Then Friday night comes around and you pour yourself a drink. What could possibly go wrong? Everything. And I mean everything. Most people think mixing alcohol with medication is just about getting a little more dizzy or sleepy. That's not even close to the truth. Some combinations can literally shut down your organs. Others can make your medication completely useless. And the scariest part? Your doctor probably didn't tell you about half of these risks. Let me share something that happened to a friend of mine. He was taking antibiotics for a simple infection. Nothing serious. One beer at dinner, that's all it took. Within hours, he was in the emergency room with severe chest pain and difficulty breathing. The doctors told him he was lucky. Some people don't make it. So why is this such a big deal? Your liver processes both alcohol and most medications. When you combine them, you're essentially asking your liver to do two jobs at once. It's like trying to text while driving. Something's going to get missed. And when your liver misses something, the consequences can be deadly. Let's start with the most common medications people take every single day. Pain relievers. You know them. Tylenol, Advil, Aleve. Seem harmless, right? Mix Tylenol with alcohol and you're setting yourself up for liver failure. Not might. Will. The combination creates toxic compounds that destroy liver cells faster than your body can replace them. Here's what happens inside your body. Alcohol breaks down into a chemical called acetaldehyde. Tylenol breaks down into something equally toxic. Your liver can handle one or the other. But both at the same time? It's like pouring gasoline on a fire. The damage accumulates with every drink, every pill. You might not feel it today or tomorrow. But 5 years from now, when your liver starts failing, you'll wish you had known this. But pain relievers are just the beginning. Antibiotics are another massive problem. Remember that friend I mentioned? He was taking metronidazole, a common antibiotic. Mix it with alcohol and you get what doctors call a disulfiram reaction. Your face turns red. Your heart races. You vomit uncontrollably. Your blood pressure drops. In severe cases, people go into shock. Why does this happen? The antibiotic blocks an enzyme that breaks down alcohol. So alcohol builds up in your bloodstream to toxic levels. It's the same reaction that happens when alcoholics take medication to help them quit drinking. Except you're doing it by accident. And you have no idea it's coming. Now let's talk about something even more dangerous. Antidepressants and anxiety medications. Millions of people take these every day. And millions of those people also drink alcohol. This combination doesn't just make you drowsy. It can stop you from breathing. Here's the thing about these medications. They work by changing chemicals in your brain. Alcohol does the same thing. When you combine them, you're essentially overdosing on sedation. Your brain slows down. Your breathing slows down. And if you're unlucky, it stops completely. People have died in their sleep from this exact combination. But it gets worse. Some antidepressants actually increase alcohol's effects. 1 drink feels like 3. 3 drinks feels like 10. You lose coordination. Your judgment goes out the window. You make decisions you'd never make sober. And because the medication masks how drunk you feel, you keep drinking. Until it's too late. What about blood pressure medications? This is huge because nearly half of American adults take these. Mix them with alcohol and your blood pressure can drop dangerously low. You stand up and pass out. You hit your head. Or worse, your heart doesn't get enough blood and you have a heart attack. The mechanism here is actually pretty straightforward. Blood pressure medications work by relaxing your blood vessels. Alcohol does the same thing. Together, they relax your vessels so much that blood can't flow properly. Your brain doesn't get oxygen. Your heart struggles to pump. And you end up in serious trouble. Diabetes medications present another terrifying combination. Alcohol lowers your blood sugar. Diabetes medications lower your blood sugar. Put them together and your blood sugar can crash to life-threatening levels. You become confused. You start sweating. You might have a seizure. And if you're alone when this happens, you might not wake up. Here's what makes this particularly dangerous. The symptoms of low blood sugar look exactly like being drunk. Slurred speech. Poor coordination. Confusion. So people around you think you're just intoxicated. They don't realize you're actually dying. By the time someone calls for help, permanent brain damage may have already occurred. Sleeping pills and alcohol create one of the deadliest combinations possible. Both are central nervous system depressants. That means they slow down your brain and body. Take them together and you're playing Russian roulette with your life. Your breathing can become so shallow that you suffocate. And you won't even wake up because both substances suppress your body's alarm systems. Celebrities have died from this exact combination. Regular people die from it every single week. The problem is that it seems so innocent. You can't sleep, so you take a pill. You had a drink at dinner. What's the harm? The harm is that you might never wake up. Your family finds you the next morning. And there's nothing anyone can do. Blood thinners like warfarin present yet another serious risk. Alcohol interferes with how these medications work. Sometimes it makes them too strong, causing dangerous bleeding. Other times it makes them too weak, allowing blood clots to form. Either way, you're in danger. And the worst part? The effects are unpredictable. The same amount of alcohol might have different effects on different days. Think about what this means. One drink might cause a brain hemorrhage. The next drink might cause a stroke. You're literally gambling with your life every time you take a sip. And unlike casino gambling, the house always wins eventually. Allergy medications seem harmless. But mix them with alcohol and you're asking for trouble. The drowsiness becomes extreme. Your reaction time slows to dangerous levels. Driving becomes deadly. Even walking can be hazardous. People have fallen down stairs, walked into traffic, and had serious accidents because they underestimated this combination. What's particularly insidious about this is that many allergy medications are available over the counter. You don't need a prescription. So people don't think of them as real drugs. They pop a pill for their sniffles and have a beer. And suddenly they can barely keep their eyes open. Behind the wheel of a car, that's a disaster waiting to happen. Stomach medications like those for acid reflux or ulcers also interact badly with alcohol. Alcohol increases stomach acid production. The medication tries to reduce it. You're working against yourself. Plus, alcohol can irritate your stomach lining, making your condition worse. You end up needing more medication, which creates more problems, which leads to more medication. It's a vicious cycle. And here's something most people never consider. Alcohol can actually change how long medications stay in your system. Some medications get flushed out too quickly, making them ineffective. Others stay too long, building up to toxic levels. You think you're taking the right dose, but alcohol has completely changed how your body processes it. The timing matters too. You can't just avoid drinking while taking your pill. Many medications stay in your system for hours or even days. That glass of wine at dinner might interact with the medication you took that morning. Or the pill you'll take tomorrow might interact with the drinks you had tonight. The window of danger is much wider than most people realize. So what should you do? First, read every medication label. Every single one. Those warnings aren't suggestions. They're life-saving information. If it says don't mix with alcohol, that means never. Not even a little bit. Not even on special occasions. Second, talk to your pharmacist. Not just your doctor. Pharmacists are medication experts. They know the interactions. They can tell you exactly what will happen if you mix your specific medications with alcohol. Ask them directly. Don't be embarrassed. Your life is worth more than any social awkwardness. Third, keep a list of everything you take. Prescription medications. Over-the-counter drugs. Supplements. Everything. Show this list to your doctor and pharmacist. Make sure they know the complete picture. Because even they can't help you if they don't know what you're taking. Fourth, if you do drink, wait. Give your body time to process your medication before you have alcohol. How long? Ask your pharmacist. It varies by medication. Some require waiting a few hours. Others require days. But waiting could save your life. Fifth, watch for warning signs. If you feel strange after mixing alcohol and medication, get help immediately. Don't wait to see if it gets better. Don't sleep it off. Call for help. The embarrassment of a false alarm is nothing compared to the tragedy of waiting too long. Here's the bottom line. Alcohol and medication don't mix. Period. The risks are real. The consequences are severe. And no drink is worth your life. I know social pressure exists. I know drinking is part of many cultures and celebrations. But so is staying alive. You have a choice every time you reach for that glass. You can choose the temporary pleasure of alcohol. Or you can choose your health and safety. One leads to good times and foggy memories. The other leads to a long, healthy life. Which one matters more to you? Remember my friend with the antibiotic reaction? He's fine now. But he'll never mix alcohol and medication again. He learned his lesson the hard way. You don't have to. You can learn from his mistake. You can protect yourself and the people you love. Share this information. Talk about it. Make sure your friends and family know these risks. Because chances are, someone you know is mixing alcohol and medication right now. They might not realize the danger. Your conversation could save their life. The next time a doctor hands you a prescription, ask about alcohol. The next time you pick up medication from the pharmacy, read the label. The next time you're at a party with a drink in your hand, think about what medications you're taking. Make the smart choice. Make the safe choice. Your future self will thank you.